Welcome everyone to our online panel discussion called Running with Endurance, Fighting Homelessness Together During a Pandemic. I'm Nicole Tschetter, the Public Relations Manager here at Denver Rescue Mission. We have an exciting program for you to hear from leaders at Denver Rescue Mission and the City of Denver on how we've been working alongside one another throughout the last 6 months to develop new and critical solutions to serve those facing homelessness during this time. Before I introduce our panelists, please find the Q&A panel here in Microsoft Teams. We invite you to submit your questions there during the discussion, and our panelists will respond to questions toward the end of the event. We'll also be posting announcements in that section. Now, let's hear a little more about our incredible panelists for this evening. First up is Britta Fisher. She was appointed as Executive Director of Housing Stability and Chief Housing Officer for the City of Denver by Mayor Michael B. Hancock in June of 2018. She was also appointed by Governor Hickenlooper to the State Housing Board and served 8 years. Governor Polis recognized her service to the state by declaring Britta Fisher Day on January 20th this year. How exciting is that? Britta's passion and expertise for housing is reflected in her leadership as she's advocated for affordable housing solutions and funding. She's played a pivotal part in response efforts to serve those facing homelessness in our city during COVID-19. During these challenging times, she's worked closely with the mission and other local service providers to develop solutions and open temporary shelters, which you'll hear more about tonight. Second up is Brad Meuli. He has been president and CEO of the mission for 21 years, leading the organization through several growth stages in 2 decades. He's now been leading operational changes necessary to serve those facing homelessness in safe and socially distanced environments, including shelters at the National Western Complex, Denver Coliseum, and 48th Avenue Center. He serves on the Homeless Leadership Council and meets with leaders from other homeless service providers in Denver regularly. He also serves on the executive committee for the Department of Housing Stability. Last but certainly not least is Tracy Brooks. Tracy is the Senior Director of Emergency Services and oversees the front lines of Denver Rescue Mission's shelter operations. She has worked directly with city officials and partner agencies to implement and run the 24/7 shelters at the National Western Complex, Denver Coliseum, and 48th Avenue Center. She brings a wealth of knowledge in the human services field, including formerly serving for 8 years at Salvation Army. Panelists, thank you so much for being here with us tonight. Let's dive right into our discussion. This first question is for Britta. Britta, what is the Department of Housing Stability, also known as HOST, and can you give us a brief overview?
The Department of Housing Stability is actually one of the newest agencies within the city of Denver. We were created in October of 2019, and we really brought together the housing portfolio that had sat in economic development, along with Denver's Road Home that had been part of human services, and really combined those portfolios and added a new dimension. The mayor's vision is a healthy, housed, and connected Denver. And to do that, he wanted to have an agency that could be elevated to a cabinet level leadership position with a department that's focused on housing as an essential city service. And we know that part of getting people to housing is also ensuring that we have knit together our services, sheltering, and interventions for people experiencing homelessness so that everything is pushing people to housing and services. So that is really the vision there. We have 3 divisions of housing stability, homelessness resolution, and housing opportunity.
Thank you so much for answering that first question. And now, Brad, let's go back to March when we knew COVID-19 would be a major challenge and we needed to adapt and find new solutions to properly shelter those facing homelessness to prevent the spread of the virus. What did it look like to work with HOST in March to begin considering alternative locations and means for shelter?
Nicole, thank you. And Britta, thanks for joining us. We really appreciate it tonight with all of our folks. And Tracy, I know you're going to hear from Tracy as well, and you'll be excited to hear from her. Listen, I don't think anyone had any idea in March what this would look like. We very, very quickly realized that we needed to socially distance, and we couldn't in shelters. Shelters are designed to have as many people in. In our city, we want to make sure that people don't freeze to death, that they don't go hungry, and we try to put as many people in a shelter. And so we pretty quickly realized to be able to socially distance, we were going to have to do some different kinds of things. And one of the things that we began to do as shelter providers across the city through the Homeless Leadership Council was to meet with the city, with Britta, with her host team, to talk about other options. What ended up happening for the Denver Rescue Mission was that we basically suspended operations at our other shelters, and working very closely under Britta's leadership, we moved out to the National Western with 763 beds for men. And then women were taken over to the Coliseum, and that was operated by Catholic Charities, Gathering Place, and Dolores Project. And so that's basically what happened. It allowed us to socially distance. South Street Medical Center came in and so that we would be able to check people and determine, where they might go. The other thing that happened under Britta's leadership is I believe it was 850 hotel rooms came up for folks that needed to quarantine or were at great risk. And so that's the kind of collaborative effort really that Britta helped lead us through here at the Denver Rescue Mission and in our city.
Brad, thank you so much for that answer. The next question is for Britta. What role did the Department of Housing Stability take in working with local organizations, including Denver Rescue Mission, to find solutions and new ways of operating to serve those experiencing homelessness? And why was it important to you to take this role?
Yeah, thanks for that question. And as Brad said, we were thrust into new situations. I love that the subtext or the subtitle on this event is about serving people in a pandemic. Who would have imagined that you had an event with that this year, right? Like no one saw this coming. We all came together to do what we could. And so our role in all of that was really being at Command Central. So there's an emergency operations center within the city of Denver. And so I served out of a bunker basically for months. Brad and Tracy got to see me every day on calls in my vest down in the bunker. And what we were doing was trying to get resources to all the right people. And I'm so proud to serve for an administration that prioritized people experiencing homelessness in this pandemic. We had Bob McDonald, our chief public health official, on calls every day with our shelter providers, giving guidance as best as we could because information was coming in quickly and changing just as quickly. We worked together with the Homeless Leadership Council and really collaborated with our partners. And so I was one of the people who was making sure that we had that connection, that we could get resources to the right places. In some cases, it was directing the literal troops. We had National Guard members that were deployed to serve on the sheltering mission here in Denver as part of our pandemic response. I had a major and a captain assigned to be with me every day to help deploy our troops out to our existing shelters and those motel and hotel rooms to help supplement the staffing that we needed for these various locations. Because as Brad said, we needed a ton more space to serve the same amount of people, with 56% of our beds really not usable because of physical distancing. So those roles were all essential. But the other thing that people don't always realize is that we also redeployed city employees from other agencies to sheltering. So we had people who had never been shelter workers before, really trained up by the Denver Rescue Mission and other providers to help provide that critical role, because so many volunteers were not able to participate in helping to serve because of the COVID pandemic. And we needed so many more people to operate these different facilities. And so we're grateful to the many city employees who stepped into a direct service role, which the city typically does not have with sheltering. So it was a whole new world and a whole new role. But what really impressed me the most throughout all of this is that everyone just swiveled to what the need was. It was so clear that we needed to serve people who didn't have homes. And I'm just so impressed by how our community rose to that challenge and got it done.
It's so incredible to hear a little bit more about the collaboration that happened between all the different entities in Denver. So thank you for expanding on that, Britta. The next question is for Tracy. One of the biggest pieces the mission was tasked with at the beginning of all of this was the operations at the National Western Complex. What were the components involved in operating that facility, and how were the guests better served by the different organizations coming together?
I think first of all, I'd like to point out that Britta took us to several locations to look at for sheltering. And as we looked at shutting down our shelters and bringing everyone into a corporate setting, we looked at several locations and ended up at the National Western. So we had 140 feet, and so we could social distance all of our men. We brought all of the men from the shelters that we had at Rescue Mission, from Holly Center, from downtown, from 48th into that location. And the collaboration continued there. And we had South Street Clinic, Cloud Coalition for the Homeless. They're doing the temperatures, as Brad talked about, and they also had a clinic set up. Individuals could access healthcare anytime they needed it during the day. Happened 24 hours a day. We had Bayard there doing client laundry. We had city staff there helping with the logistics every day of getting masks there, getting blankets washed. And then National Western staff stepped up. They were helping with the cleaning, and K&M, the caterers, all the great burgers and pulled pork for the stock show, stepped up to cater all of our meals. And so it was really great to see this collaboration, everyone coming together to meet the needs of the individuals served there. And it was we had really 24-hour sheltering, and with all of that support, it went wow.
And Tracy, do you have a personal story about the National Western Complex?
I think one of the stories that really stayed with me since we've left there is really thinking back to, we had an individual who was actually suicidal and attempted suicide. And because we had the support of Stout Street, we had paramedics readily available, we were able to get him to safety right away. And so he was taken to the hospital, and he went to one of the hotels that Brad referred to for respite care, was able to recover. And then he returned to National Western, and there he was able to get the ongoing physical attention he needed, health from Stout Street. And then Deb Butte, our director of intake and diversion, really came alongside of him and started working with him and getting him placed on the housing list for one home, and just really stayed with him. And a week before we moved out of National Western, he got housed. And I look at that as just this collaboration really coming together and supporting someone really in need and ending up housed at the end of all of this.
Thank you so much for sharing that really powerful story, Tracy. We so appreciate all of the work that you and everyone else on the front line does on a daily basis. The next question is for you as well. Since August, the mission has transitioned out of National Western and into two 24/7 shelter locations. Can you go into a little bit more detail on what this looks like?
Sure. So as the National Western, we started moving to the 48th Avenue location and looking for somewhere else to move the men. The women were returning to the Smith Street location with Catholic Charities and moving into hotels. And so the men, we moved about 300 of them over to the Coliseum, and then we moved the other half to 48th Avenue Shelter. And at the same time, we were shutting down DRML, the Jesus Saves building downtown, because we had been planning for quite some time to do a renovation there that would make it ADA accessible. So we did not have those beds available. So we stood up the other two locations at 48th Avenue and the Denver Coliseum as 24-hour shelter. And we were fortunate, we were staffed coming out of National Western. We had people to move to those locations. And I am excited because we are now offering case management at 48th Avenue. And so as we have done that case management, we've had almost 80% of those guests engage with case managers there and working towards getting out of homelessness. In addition, Stout Street Clinic went with us over to the Coliseum. Bayard went with us to both locations, and so that collaboration continues. And we have the city support at those locations as well.
Thank you, Tracy. The next question we have up is for Britta. While it's challenging to plan more than a few months in advance, how long do you anticipate the Denver Coliseum will serve as a shelter facility?
Thanks for that question. You know, one of the roles that I've had in all of this is looking at really hundreds of buildings around Denver, evaluating them for shelter in an emergency. And we were fortunate that the Coliseum is a city-owned facility and much easier for us to access. At this time, we do not have a definite closing date for the Coliseum. As much as anyone else, I'd love to be able to say that I know when coronavirus will be lifted and we can move forward. It's probably the question that I get the most. However, the reality is that we in Denver, along with all of our providers, are going to provide the support that people seek. And we're going to make sure that there's enough shelter for that to happen. We are loath to take the Coliseum out of the equation until we know that we can meet all the capacity demands. We are and have announced a new shelter that is near the existing 48th shelter in order to provide more capacity. So we expect there to be more than 400 beds at that facility, and it could have flexible uses within our system. So as we prepare that facility, we'll work with our partners as to who we can best serve there, and we will monitor at the Coliseum and see when the appropriate time is to turn that back into an event space. For now, there's a lot more demand for that to be a shelter than there is for large events.
Thank you, Britta. There have been developments this week with the safe outdoor sites. Britta, could you give us an update on where those stand?
Sure thing. So, you know, our goal overall at the Department of Housing Stability in the city of Denver is to get people housed. That is really what all the things that we do drive toward. That said, we need to meet people where they're at. We need to provide services until that housing is available, and we need to reduce harm to people. And when we had this pandemic facing us, it was so clear that we needed to help support people without homes. And our public health department has been a key partner in all of this. And one of the things that we've collaborated on is to really take a new look at maybe it's time to give a try to a temporary managed campsite. Right now, what is happening outside on the streets of Denver with unsheltered homelessness is unhealthy. It is unhealthy and unauthorized. And how can we introduce services, sanitation, and some management that we can offer that gives folks a chance to reduce harm as they are able to better access those services for the future? And so We're continuing to work through sites. We have looked at many sites, more than 90. We will continue looking. There are a lot of technical barriers. We have never tried a temporary managed campsite before in Denver. And so our rules, our ordinances, our zoning are still not reflective of us trying to do that. And so we're making some fixes to some of those rules that will help us with finding sites. But overall, I think the thing that you've seen play out in the news is that we need people to talk about our unhoused neighbors like Denver Rescue Mission talks about our neighbors. We need to think as a community, how do we want to meet people who are in a housing crisis? How do we want to bring our unhoused neighbors into housing, and how that can be throughout our community? And I think that's one of the things that we as leaders who have compassion for our unhoused neighbors need to help show the way in our language and in our embrace of people who are living unsheltered homelessness.
Thank you so much, Britta. The next question is for Brad. As we anticipate the impacts of COVID-19 causing many to lose their jobs or homes, as well as anticipate the approach of colder weather, how are we preparing for this potential impact?
Yeah. So, Nicole, let me just, I'll respond to that question here in just a second. I wanted to just connect with something Britta said. You know, when she talks about the city wanting to get people housed, really, this is what we want to do at the Denver Rescue Mission. We want to see people get out of homelessness. Our mission statement says we're changing lives in the name of Christ and trying to help people become productive, self-sufficient citizens. And so we are like-minded with the city, with other service providers, and really trying to get people out of homelessness and back into housing. And so I just wanted to make that comment, because this allows us to really be able to work closely with each other. In terms of the COVID-19 in the winter weather, listen, this has us all concerned. At the Denver Rescue Mission, we're doing a couple things. One, at Lawrence Street, our Lawrence Street facility, we are trying to preserve the beds there. And so working closely with the city again through a grant that they've provided us, we have 200 beds there. We're trying to spread those beds out, but in order to do that, we have to redo our basement. So we're going to have 100 beds upstairs and probably around 90 beds downstairs. So we're preserving the beds there. And this piece just came in as we walked the Holly Center, which has 200 beds. We had implemented the Holly Center as a overflow facility and began to do that. We've had between 26 and 70 folks, but we walked that with the health department. They have 200 beds there, but because they're bunked, because there are dividers there, the health department has given us the okay for 200 beds to be there. We thought it would only be 100, but now it's 200. And so that's a terrific thing. And then we're all concerned about this, as I said earlier. And one of the things that we're very excited about is the new 48th. We sometimes call it 48th 2.0 or 48th East, that the city is working desperately to try to get up online before December 31st. And so these are just some of the ways I think that we're trying to work together to make sure that we don't have to turn anyone away. And just so you know, Denver Health and hosts have been, really good in working with us and saying, look, when it gets really cold, we don't want to turn anyone away. So what can we do? We actually have about 70 some mats that we're ready to implement at the Coliseum if we get to a max number of 300 there. So we're going to do everything that we can to take care of people that are outside and cold and hungry.
Thank you, Brad. Tracy, your operations and emergency services have transitioned several times in just 6 months. You've tripled the number of employees on your team along with this. How have they been managing the adjustments to new work environments and operations?
Well, I think the interesting thing is that at National Western, my employees were averaging 27,000 steps a day. And so these smaller locations have been welcomed by my staff. And so they are happy to get moving to the Coliseum. And for my staff moving to 48th, it was really going home. We're excited that some of our kitchen staff came. They're preparing the meals down at Lawrence Street Community Center, transferring them over to 48th every day so they get to see their teammates from Lawrence Street. And then we have our custodial team that's come alongside. We've also hired a number of individuals and that have come onto our team, and we're impressed. Our HR team stepped up to the plate and brought us in some really great employees. A lot of them lost their jobs during COVID. They worked in events, they worked in other places, and they have come on, and it's been amazing how well they've integrated into our team and what they've stepped up to. In fact, today I was talking to one of my directors, John Seiler, and he was telling me about a new employee, Matt, who gave up his long-term job because he was so excited about working here and enjoying the experience so much of working with the individuals that we serve every day and giving back and doing something that was really needed. I have another individual who came from the computer programming background, and same thing, has walked away from that because after his time here as a temp employee, he's decided to come on full time and stay with us. And so really seeing just these great individuals who are coming alongside of us. And then we have had just incredible support from the city, from partners, and especially from our coworkers who've gone out of their way to make our staff feel loved with meals late at night and early in the morning, cards and notes and everything, just to remind them that they're not alone. And we really appreciate all of that.
Tracy, I know just a couple of times I've gone down to volunteer. It is just absolutely amazing to see your staff in action and serving our neighbors experiencing homelessness. Just a quick reminder before we move on to the next question. If you guys at home are watching and you guys have questions, make sure to submit those and we will try to answer as many of those as possible. And Tracy, the next question is actually for you again. What have we learned about operating 24/7 shelters, and what is the impact they have in serving our homeless neighbors effectively?
I think one of the realities that we quickly came to realize is what a blessing sleep and permanency is for those that we care for. And so as we moved into National Western and individuals were in the same location all day, they started sleeping. And I know when I haven't had enough sleep, I can get a little cranky and stressed. And it's hard to look up and look forward when you're tired. And being in the same location, our guests just really got some great sleep. And we started seeing individuals who had been tired for a long time really starting to come around and talking to us. We had our peer navigators out and available, and they started engaging with those individuals. We've also found with South Street Clinic being readily available and case managers being readily available, people want to engage. They want to ask questions, and they want to have those individuals that come alongside of them as they navigate through homelessness. And we have often said it's not easy when you're homeless. It's a full-time job to try and figure out where your next steps are. And to have our case managers at the shelters who are coming alongside of individuals as they're ready to engage on the day they're ready to engage has really proved to be a great blessing. We are seeing individuals, I said 90% of our appointments are full. We have 5 full-time case managers at 48. They're filling about 90% of those appointments. We have walk-up, we have people getting on the housing list every day, and it's just pretty amazing.
Thank you, Tracy. Britta, what has the Department of Housing Stability learned in the last 6 months about housing and sheltering those facing homelessness? Also, what are you focusing attention on for the next 3 to 6 months?
I could probably talk a long time about the many things that we've learned. But, you know, I think there's a few strong themes and honestly big wins, despite there being a pandemic. One, the collaboration and partnership of the people who care and show the compassion for people experiencing homelessness in our community runs so deep. And to watch everyone come together and say, we'll figure out the paperwork, we'll figure out all the other things later, we have people to serve right now, tells me that we just have tremendous partners like the Denver Rescue Mission who are willing to show up for people even when everyone else was staying home. I think secondly, the around-the-clock sheltering difference has been profound. It was already in our strategy, but we really did this in an amazingly short amount of time. March 12th was stay-at-home orders. By April 20th, we had converted most of the shelters and all of the large shelters in Denver to 24/7 around-the-clock sheltering. We took a 3-year strategy and basically achieved it in 5 weeks. That's pretty amazing to see the opportunity in a crisis and in an emergency and say, this is the right thing to do right now. When we tell people to shelter in place, they need to have places that they can access their bed, their belongings, and feel a sense of safety and security all day long. And I think when we, as we move forward, we have to preserve that. We have got to keep the resources flowing to make that a reality. It takes more staffing. It takes more integration of services like healthcare and behavioral healthcare. It takes a lot of partners working together. And we have shown that we can do it, and we need to keep delivering for Denver and for the region by continuing that. The other thing that I've learned is the importance of running the race with the community. I played soccer and basketball and all sorts of things. It's because I really don't like to run with endurance just for the sake of running. I need a ball or people with me. But in this particular race of the pandemic, it was inspiring to me to see the change in our guests as we were able to come together and provide these services, to see people have less anxiety, to be better rested, to still get all the way to housing during this pandemic. It was really encouraging to see people thanking Tracy and her team for what everybody was doing and for showing up for them. Some of those first weeks of the pandemic when everything else was closing, our shelter workers showed up, and guests would come up to people and say, thank you. Thank you for still caring and being here for us. Yeah. And that just shows the character of our community, of the Denver Rescue Mission, and all the partners who do this work day in and day out. And I don't think we can commend them enough. So as we turn to the next 3 to 6 months, we're going to build on those strengths. We have tremendous partners. We have tremendous support from this community overall. People see the desperate need that is out there. It has been a tough pandemic. Unsheltered homelessness has grown. Tents have proliferated. That is because more and more people are in a housing crisis. But I know Denver to be a compassionate city. I know our partners to have endurance for this particular race. And we're going to go through this together. I think our points of emphasis will be the winter capacity. No one wants anybody to be cold and hungry this winter or any day. We need to get the new shelter set up and operating so that we have plenty of capacity for people who seek shelter. We need to continue to work with those who are not seeking shelter. We just announced this week at committee additional supplemental funds for outreach to people experiencing unsheltered homelessness. This will this will really be a doubling in 2021 in the new city budget of outreach resources. And we need that to go with the doubling of unsheltered homelessness that we have seen. We want to get all of everyone connected to services that we can. And then our final thing is really looking ahead. We, throughout this process, believe it or not, have still been working on strategies for the future. And Brad serves on the executive committee of our strategic plan. We are releasing next week to the public our one-year action plan. And then we will be working throughout 2021 to then produce a 5-year plan outlining our plans for housing and homelessness in Denver. We do not do this work alone at the city. We are one of the funders, one of the resources, but we do this in partnership with other funders, with partners like the Denver Rescue Mission and our nonprofits throughout the city, but also with our residents and our business leaders. And so we need to come together and paint the path for the future so that we can find a Denver that everyone is healthy, housed, and connected.
Britta, that was an absolutely remarkable answer. I loved that you talked about, the big wins that we're all seeing during these tough times and really coming together. The last question is for Brad, and it's actually the same question we just asked Britta. What have we here at Denver Rescue Mission learned in the last 6 months, and where are we focusing attention on for the next 3 to 6 months?
So I really feel like I should just say I agree with Britta, and just ditto. She said so many great things. One of the things she said, which is so true, is I have just been humbled by our employees and their willingness to go right into the fire and continue this marathon. It's not a quick basketball game. It definitely is a marathon. So I think though what I've learned is maybe what I've been reminded of, and this has really probably been the biggest thing that I've been reminded of, is that I'm not in control. And so I have told our employees time and time again that God is in control. And for some reason, he chose us for this particular time to be in this particular position. Of all the people that have ever lived, we're living through this pandemic, and we have this wonderful opportunity to come alongside a city, frankly, that wants to take care of people, that wants to make sure, and we have that opportunity. And so we absolutely believe at the Denver Rescue Mission that God is in control. We don't always understand everything that's happened, but I know I'm not in control. I think Tracy also alluded to, she was very specific on 24/7 shelter. We've learned a lot about 24/7 shelter. Maybe we, as Britta said, we've learned 3 years worth of information in just a few short weeks. And we've been so excited that folks, when they're getting rest, when they're being, certainly fed well, and they're 90% of our folks are coming, they want to meet with a case manager. And so that's so encouraging to us that as we try to move them out of homelessness. We've also learned to be adaptive. We've had to pivot, we've had to flex, and so we really had to be adaptive in this process. And we've learned that we can do that. And the Denver Rescue Mission is not a building. We might be at Lawrence Street, we might be at the National Western, we might be at the Coliseum. The Denver Rescue Mission is an organization that's been around 128 years, and our desire is to see people's lives changed in the name of Christ wherever we are. And so we don't know what the next 3 to 6 months really look like. I've heard that long-range planning is about 90 days right now. And I think that's really probably a real a good statement. And so we may be at another facility, but wherever we are, we're going to bring that love and compassion for people as we reach out to poor and needy people. And then just the very last thing I want to say is I've also learned that good times or bad, the donors that we have at the Denver Rescue Mission are wonderful. And they believe in us, which chokes me up. And I just really appreciate the support that they have provided the Denver Rescue Mission as we have fought through this pandemic and continue to fight through it. So thank you.
Thank you so much for sharing that heartfelt message, Brad. I feel as if, as an employee and everybody watching tonight, we really support that message that you just shared with us. So we have had an overwhelming amount of questions about what individuals can do to support Britta's efforts as well as Denver Rescue Mission's efforts, not just now, but coming up through winter. So Britta, would you maybe want to touch a little bit more on how individuals out in the community can come alongside all of the homeless service providers to provide these essential services?
Great. I'll try to keep it short, but it's hard for me because there's so many things to do. But, no matter where you live, whether it's in the city and county of Denver or anywhere, any community in Colorado, one of the first things that I would encourage any person to do is to show up for your network, for your family, for your friends. People experience housing crisis every day, and people who never imagined they would be facing a housing crisis are facing one in this pandemic. And so however you can show up for your friends, your family, your immediate neighbors, that's a really important way that you can serve your community and help us all, because when we connect people to resources and support early in a housing crisis, that's one of the greatest predictors of who will get through that quickly and who will end up facing unsheltered homelessness or sheltered homelessness. It's that support network. It's a person who cares. So be a person who cares. The second thing, for people who are in the city and county of Denver, I would say we do have a city referred measure that is being put before the voters that is about addressing homelessness with sales tax resources. I would encourage everyone to look at that information and to vote. So as we face this fall, we want to encourage people to be a civic participant in the decisions around how we resource the city and county of Denver to do this work, and therefore our partners. And the final thing I would say is do all the things that Brad's about to say. We really need people to show up for our partners. And, I am not only a city employee, I am a woman of faith. And I echo Brad's sentiment that the race up before us, we are the people who are here right now, and we need one another more than ever. And so the ways that you can give, that you can tithe, that you can give the scarves, hats, sneakers, and toiletries that people need, those things matter. And so please do whatever you can to help our neighbors.
And Tracy, kind of gearing the next question towards you. I know we're coming up on our time here, but I want to get one more question from the community out there. Denver Rescue Mission is known for our incredible sheltering options, but we also do so much more. Could you maybe touch on the services we provide at 48th and the Coliseum, whether that includes items such as mental health or shelter diversion? I know that's kind of a big question, but maybe the top points of that.
Sure. I think we want to really meet everyone's basic needs, right? So we have a place for them to sleep, they're fed well, as Brad said, and then we also are offering the supports around health with South Street Clinic at the Coliseum and case management with our Next Step team. And so our Next Step team started at DRML at the Jesus Saves building downtown, and it was really isolated to that location, and individuals had to come into it. And as we faced this challenge, we took that whole team and put them at 48. And Deb Butte, who is our amazing director over that team, developed 22 points of things that people need to accomplish in order to resolve homelessness and become housed. And that team works every day diligently to check those boxes for the individuals who are staying at 48. And through that, we're starting to see people get housed that have been at 48. Some of them have been there a long time. Some come in and just need that minimal support for someone to come alongside of them and point them in the right direction. In addition, we're able to point them to other resources in the city because we want to make sure they know where to go if they ever end up here again. So we're connecting them to Denver Human Services, the VA. We have all of those resources coming in to 48 to come alongside our individuals. We have legal aid, and then we also have Denver Human Services who comes in and helps with documents.
Thank you so much, Tracy. Unfortunately, we have reached the end of our time together for this evening. Britta, Brad, Tracy, thank you all so much for your leadership in this marathon race of responding in new ways to serve those facing homelessness. Thank you so much for your time this evening to share on this online event for our supporters. For all of you viewing this event online, thank you for your support of Denver Rescue Mission and for your partnership to serve the most vulnerable in our community. We're so grateful for your support, for your resources, volunteerism, and prayer. We've posted a few ways you can respond to tonight's event and to help. We invite your feedback on this event, and we invite you to join us for our next online event on October 7th. That's one you don't want to miss for sure. We've also posted the link if you'd like to make a donation or sign up to volunteer. Volunteers are greatly needed to serve meals at both the Denver Coliseum and 48th Avenue Center. Please check the announcements for those links to sign up to volunteer and to get involved. We'll also be sharing the recording from this online event in an email, so you'll be able to revisit that information presented or share with someone else if you'd like to do so as well. Thank you all so much for joining us tonight. Have an absolutely wonderful evening.